This is Ashley Walker recording for Tracy Pearson. She will be performing wound care.
So the first thing I'm going to do is review my physician's orders. I'm looking for any topical agents that I may use, along with any dressings that I'll need to use for this procedure. I've gathered my supplies. I have my normal saline. I have my measurements, my disposal measurement. I have my calcium alginate, my ABD. I have my sterile cotton tip applicators, my sterile gloves, my clean gloves, tape, my Sharpie pen, as well as my 4x4 gauze. Good morning. My name is Tracy. I'm going to be your nurse today. Can you tell me your full name and date of birth? Good. Coming in this morning because I need to change the dressing on your bottom. Is this an appropriate time for that? Would it work for you? Good. Okay. A couple of things before we get started. Do you have any allergies to latex or topical agents that I should be aware of? Okay. I'll double check the chart as well. And how are you doing as far as pain? No pain? Do you feel like maybe we should get something on board prior to beginning this? You don't. Okay. However, if my patient did need pain medication, I would make sure that I obtain that first, making note of the peak time of the medication, not to start the procedure until the medication had time to kick in. So I'm just going to gather my supplies to wash my hands and we'll get started. So I'm going to pull the curtain, I'm going to perform hand hygiene, and I'm going to apply my gloves. So I'm going to position my patient into a prone position. I'm going to keep you as comfortable as I possibly can, okay? I have some nice warm bath blankets here we're going to put on. I would make sure that I apply these seams up, covering my patient. So I'm just going to keep your bottom exposed so I can reassess this wound, okay? So my patient is repositioned. And I'm going to take this tape off. Grab my bag here. This might be a little easier. Okay, so we have a small amount of sanguinous exudate on the ABD, and we have a moderate amount of sanguinous on the 4x4 gauze. I have a sacral wound here, and it's a stage 4. I know it's a stage 4 because it's at full thickness, and I see exposed bone. So now I want to go ahead and measure that. Are you still doing okay, Mr. Pearson? Okay, good. So I need, excuse me, I need to measure the length. So for length, I have 10 centimeters. For width, I have 8 centimeters. And depth, I'm going to go to the deepest part here. And for depth, I have 3 centimeters. I have undermining from 10 to 2, and I need to measure that as well. So undermining at 10 o'clock is 2.5 centimeters. Undermining at 12 o'clock 2 centimeters. And undermining at 2 o'clock is 1.5 centimeters. And I have tunneling at 7 o'clock. Measuring 4 centimeters. I have 70% granulated tissue. I have 20% sloth, and I have 10% bone. There is currently no exudate present. However, if there was, I would make sure that I took note of the amount, the color, as well as if there was any odor or any other characteristics of the drainage. The surrounding skin outside of the wound looks really healthy and normal, except for we have a necrotic non-stageable area here at 5 o'clock. And the edges of the wound are jagged, I would say more so at 9, noon, and 3. At this time, I would cleanse the wound using normal saline or a prescribed cleaning agent. I would clean from least contaminated to most contaminated. And I would make sure that I gently washed and dried the peri-wound area. With my gloves, I'm going to wash my hands. At this time, if there was a topical agent that was prescribed, I would apply that. I have everything I need. I have my sterile Q-tips, I have my ABDs and my gauze here. I would make sure if it was a topical agent was prescribed, I would have gloved hands and apply that at this time using a cotton-tipped applicator or a gauze. I'm going to wash my hands. And just no set of sterile gloves. Right? Ashley, could I have you hold my calcium alginate, please? Have you turn the bottle for me a little bit, please?
Well, we did, during winter, surgical. Well, usually my that they separate the food cuisine during winter. We use surgical receptors and medical receptors.
Yes, absolutely.
Thank you.
Put that in the garbage. to put my initials, the date, and the time. And today is 11/17, and it is 09:30. Going to clean up my sterile area. Get rid of my mess here. Put these in the proper location. Wait to remove my gloves. I'm going to perform hand hygiene and going to reapply new gloves. Mr. Pearson, how is your pain doing? Still doing okay? I'm all done with your dressing change. I'm going to go ahead and get you repositioned, okay? I'm going to put you on your side. Would you rather be on your right side or your left side? Okay. So now I'm going to reposition my patient on their side. I'm going to make sure that the bed is lowered all the way to the floor. They have their call light. Anything that they may need is within reach. I am then going to remove my gloves, wash my hands, and document the procedure.